All right, diving right in. You sent this over about renal tubular acidosis.
RTA.
Yeah, RTA. I have to admit, the name itself,
It does sound a little intimidating.
yeah, a little bit intense.
Yeah.
So break it down for us. What is it?
Well, RTA is basically, your kidneys, they have a hard time maintaining the pH balance of your blood.
Right, the acid-base balance we
Exactly.
always hear about.
Yeah.
So essentially, if the kidneys aren't working properly,
Right.
then acid can build up. But it's so interesting, because this condition,
Mm-hmm.
it can show up, it can manifest in so many different ways. We're talking fatigue, bone pain, even kidney stones. It's crazy.
Yeah, you see, usually our kidneys are filtering out all those waste products and they're reabsorbing bicarbonate, which, acts as a buffer against the acid.
Right.
But when that process doesn't work properly, there can be a lot of consequences.
Okay, so let's talk about the different types, because I noticed in the research it mentions different types of RTA.
Mhm.
So it's not just one size fits all, right?
Right. No, it's not. You could think of it more like a family of disorders,
Okay.
each with their own little, unique characteristics.
Quirks.
Quirks, yeah. So, for example, we have type 1, also known as distal RTA. In this case, the distal tubules of the kidneys, they have trouble getting rid of the acid, so it builds up.
Okay.
And what's interesting is that this type is often linked to autoimmune diseases or even genetic factors.
So the kidneys themselves are the target, in a sense. It's not that they're not trying hard enough.
Right.
They're just not equipped to
Exactly.
handle that acid.
Exactly. It's like if you had a leaky faucet and you couldn't quite fix it.
Like that.
So then there's type 2 or proximal RTA. This one's different.
Yeah.
It's more like you're dropping the ball on the neutralizing agent,
Okay.
So the proximal tubules, they fail to reabsorb bicarbonate efficiently.
So it's a reabsorption issue.
Yeah. So even though the kidneys are filtering, they're not holding on to those good things, those good components.
And this one's associated with Fanconi syndrome, right?
Yeah. Sometimes, yeah.
It just seems like all these different types there's so much overlap.
There is. And that brings us to type 4, also called hyperkalemic RTA.
Hyperkalemic.
Yeah, and this one's kind of the odd one out because it involves high potassium levels.
Right.
And, high potassium can cause its own set of problems. Type 4 is often related to things like diabetic kidney disease or problems with the adrenal glands.
Okay, now high potassium, that sounds familiar. I know it's an electrolyte, but if you have too much of it, it can be an issue.
Oh, yeah, for sure.
So it's so interesting that all of these types, even though they have different mechanisms, they all still result in that same acid building up.
Yeah, different roads, same destination.
Exactly, different roads leading to the same destination, which is disrupting that balance
Mhm.
of the internal environment. But how does this all translate into symptoms? What would someone actually be experiencing?
Well, that's where things can get a little tricky.
Okay.
And honestly, a little bit frustrating for both patients and doctors because RTA is notorious for its kind of vague symptoms.
Oh, so you mean it could be those everyday things that we might not think twice about,
Yeah, exactly.
like fatigue, just general fatigue.
For example, you could feel drained. You could blame it on your busy schedule or stress or lack of sleep.
Right.
But for someone with RTA, it could be that their body is actually just struggling to maintain that pH balance.
It's like your body's trying to tell you something's off, but you're just not.
Yeah, those seemingly small things could be something much bigger.
Exactly. Yeah. What about muscle weakness or even bone pain?
Yeah, those are also red flags. And even kidney stones.
Ouch.
Yeah, kidney stones, nobody wants those.
No. You mentioned bone pain. What's the connection there?
Well, if you think back to that acidic environment, when you have too much acid in the system, it can actually leach calcium from your bones.
Wow.
So it makes them weaker, more prone to pain, and even fractures.
So it can really impact bone health.
Yeah.
I wouldn't have connected those two.
Yeah, it's one of those consequences that people don't always think about.
And especially in children, that can really
Oh, yeah. Yeah, it can affect growth and development.
be so detrimental.
Yeah, absolutely.
Wow. It really highlights the importance of early diagnosis.
Yes, absolutely. And the problem is that a lot of RTA cases go undiagnosed for years because the symptoms are so easy to dismiss.
Yeah, it's like a silent thief.
It is. And that's one of the main reasons we're even having this conversation today, to
Right.
spread awareness about this condition.
So people can advocate for themselves.
Exactly.
Yeah. Before we move on, though, I want to know what causes this imbalance in the first place.
Okay.
Because we talked about the consequences, but what are the triggers?
Well, it's a bit of a mystery sometimes.
Okay.
Sometimes it can be genetics. You might inherit a predisposition to RTA, meaning your kidneys are just wired a little differently from the start.
So it's like you're dealt a certain hand
Right.
genetically.
But other times it's environmental factors or other health conditions. Autoimmune diseases like Sjogren's syndrome or lupus can sometimes attack the kidneys.
So your body's attacking itself.
Right, and that disrupts their normal function.
Wow.
And then you also have things like chronic kidney infections.
Yeah.
Or diseases that can damage the filters in the kidneys.
Making them more susceptible to RTA.
Exactly. And then, of course, there's medications.
Oh.
Certain diuretics or chemotherapy drugs, even though they're often necessary, can sometimes increase the risk of RTA.
It's like there can be consequences even with the best of intentions.
Right. It's a balancing act for sure.
Wow. And then, of course, lifestyle. Things like diabetes, metabolic disorders.
Those can go hand in hand with RTA too.
So many potential triggers.
There are.
It seems like early detection is so important
Absolutely.
to prevent some of these consequences we talked about.
It is.
But how do doctors even diagnose RTA? What tools do they use?
Well, luckily, we're getting pretty good at identifying RTA these days.
That's
It all starts with, a good medical history, physical exam.
right.
But then we got to dig a little deeper.
Okay.
And blood tests can be really helpful,
Okay.
especially when we're looking at bicarbonate and acid levels.
So essentially checking that internal environment, making sure it's not too acidic.
Exactly.
Okay.
We also look at the urine,
Okay.
analyze its pH, see how much acid is being excreted.
Uh-huh.
That gives us a clue as to, how well the kidneys are actually doing their job.
It's like a window into the kidneys.
It is.
What about imaging, like ultrasound, CT scans? Do those play a role?
Absolutely, yeah. Imaging lets us visualize the kidneys. We can check for any blockages or abnormalities, or even, kidney stones, like you mentioned before.
All right.
It's like solving a puzzle.
Yeah.
You got to put all the pieces together.
So the sooner you put those pieces together,
Better.
the better.
Yeah. Early detection is key because then we can intervene before there's any serious damage.
Okay, so let's say someone is diagnosed with RTA. What happens next? What are the treatment options? What does life with this condition even look like?
Well, the first thing to understand is that RTA is chronic,
Okay.
meaning it's something you're going to have to manage for the long haul.
Oh.
But the good news is, with the right approach, people with RTA can live totally normal, active lives.
That's reassuring.
So what is the right approach?
Yeah, what does that look like?
It's kind of a multifaceted strategy. We want to address both the symptoms and the underlying cause.
Okay.
So one of the main things we do is alkali therapy.
Okay.
And that basically means taking medication to neutralize the excess acid in the body.
So giving your body a little boost.
Yeah, helping it restore that balance.
Okay.
Medications like sodium bicarbonate or potassium citrate, they can help raise the blood pH to a healthier level.
So medication's important, but I'm guessing lifestyle modifications are part of it too, like diet.
You're absolutely right. Dietary adjustments can make a huge difference when it comes to managing RTA.
Right.
It's all about, reducing those foods that make acid buildup
Okay.
and focusing on foods that promote alkalinity.
So are we talking about a complete diet overhaul? Or just like little tweaks here and there?
It really depends on the person and how severe their condition is.
Okay.
But generally, reducing protein intake can be helpful
Bye.
because protein metabolism can produce more acid.
That makes sense.
So some of the usual suspects are red meat, processed foods, sugary drinks. Those are the things you want to kind of stay away from.
Okay, so less of those.
Less of those. And then fruits and vegetables, those are your friends.
More of those.
Yeah, because they have an alkalizing effect.
So it's all about balance.
Yeah, shifting the balance toward a more plant-based diet. And honestly, that's good advice for anybody, really.
Yeah.
And hydration is key.
Yes.
Drinking plenty of water that helps to flush out waste products, prevents them from building up and causing even more problems.
Right. We always hear water is so important for the kidneys.
It is. It's essential.
But what about the emotional side of things? Living with RTA can be challenging, both physically and mentally.
That's such a good point. The emotional impact of RTA is something we really need to talk more about.
Yeah.
It's significant. First you get the diagnosis. That can be a shock.
Right.
You might feel scared, uncertain.
Anxious.
Yeah, maybe even angry. And then you have the ongoing challenge of managing the condition,
Right.
making lifestyle changes, dealing with potential complications.
That's tough to deal with.
It is. And that's why it's so important to have a good support system,
Right.
whether it's family, friends, or support groups.
Yeah. Just knowing you're not alone.
Exactly. And don't forget, taking care of your mental health is just as important as taking care of your physical health.
They go hand in hand.
They do.
Sure.
Now, for parents of children with RTA,
Yeah, I imagine that's a whole other...
oh, it's incredibly challenging.
Yeah.
Parents, they often face a really steep learning curve, trying to understand everything about the condition and make the best choices for their child.
So what advice would you give to those parents?
I would say, first and foremost, find a good healthcare team that specializes in pediatric RTA.
Okay.
Having a doctor, a nurse, a dietitian who really get it, who understand this condition in kids,
Yeah, that expertise is so important.
it makes all the difference. And don't be afraid to ask questions.
Yeah.
The more you know, the better you can advocate for your child.
Absolutely.
Mm.
But it's also important to remember that there will be good days and bad days.
Oh, for sure.
It's a journey, it's not.
It's a marathon, not a sprint.
Exactly.
You got to be patient with yourself, celebrate those victories, and, don't be afraid to ask for help when you need it.
And even with the best care, there might be times when the condition flares up.
Right.
Or complications come up.
Absolutely. And that's why those regular checkups are so important.
Right.
So the doctor can monitor your progress, make adjustments to the treatment plan.
Staying vigilant.
Yes, being
Yeah.
proactive about your health.
But what about beyond the medical management?
Yeah.
Are there things like lifestyle choices that
Mhm.
can make a difference?
Absolutely. Stress management is a big one.
Wait.
People don't always think about that, but chronic stress, it can really take a toll on the whole body,
Right.
including the kidneys.
It's all connected.
It is. Mind-body connection. It's
Yeah.
real. So, find some stress-reducing activities,
Yeah.
yoga, meditation, spending time in nature,
Anything that helps.
listening to music. Yeah. It can have such a positive effect on your overall health, including your kidneys.
So we're talking about a holistic approach again.
Exactly. Addressing both the physical and the emotional.
Mm-hmm. Now, before we wrap up, I want to touch on prevention.
Okay.
Are there things people can do to lower their risk of developing RTA?
That's a great question, and the answer is yes, absolutely.
Okay, good.
Now, there are some risk factors you can't control, like genetics,
Right.
but there are a lot of lifestyle choices that can make a big difference.
Okay, like what?
Well, first of all, just maintain good overall health.
Oh.
Eating a balanced diet, staying active, getting enough sleep, managing stress.
Right. Those are all good things anyway.
They are, but they're especially important for your kidneys.
How so?
Well, a healthy diet and regular exercise can help regulate blood sugar levels,
Okay.
which is crucial for preventing diabetic kidney disease.
Right, which we know is a risk factor for RTA.
Exactly. And stress management, remember, chronic stress can raise blood pressure,
Uh-huh.
trigger inflammation.
Which can damage those filters in the kidneys.
Exactly.
Wow, it's all connected.
It all comes back to that.
Everything is connected.
And of course, hydration,
Right.
water, water, water.
It's like giving your kidneys a bath.
Exactly. So I think that about covers it for this part of our deep dive.
Yeah, we covered a lot of ground today, from diagnosis to treatment,
Yeah.
lifestyle choices, even prevention. But I'm really excited to hear what you have to say in our final segment.
Well, I'm happy to share. We're going to talk about some of the new and exciting things happening in RTA research, and I'll leave you with some things to think about.
Sounds good. We'll be right back. We're back, and as we wrap up this deep dive on RTA, I can't help but think about just how interconnected everything is.
Oh, absolutely. I mean, we've talked about everything from genetics to lifestyle to underlying conditions, even medications. It's like this giant web.
Right, and it really highlights the importance of looking at the whole person, not just their diagnosis.
100%. You have to understand the individual, their history, their choices, their life, and then tailor the treatment based on that.
Yeah, personalized medicine. But something else that we touched on that I wanted to come back to is the emotional side of things.
Oh, yeah.
Living with RTA, it's got to be a lot to process.
Right. I mean, think about it. You get this diagnosis, it can be a total shock. And then all these emotions come up. Fear, uncertainty,
Yeah.
sometimes even anger. And then on top of that, you have the day-to-day of managing it, the changes you have to make, the possibility of complications.
It's an extra layer of, complexity.
It is. And that's why it's so important to have a good support system.
Right.
Support groups, therapy, even just talking to your loved ones, it can make a huge difference.
Just feeling heard and validated.
Exactly. And remember, it's just as important to take care of your mental health as it is your physical health.
They go together, right?
Absolutely.
So before we go, what's the one thing you hope people listening take away from all this?
If I had to pick just one thing, it would be to be your own advocate. Don't be afraid to ask questions. Do your own research. Get a second opinion, you know.
Really take charge of your health.
Exactly. Knowledge is power. Find a good healthcare team that you trust and listen to your gut.
Well said. This has been an amazing deep dive into renal tubular acidosis. I feel like I've learned so much, and I hope everyone listening has too.
Me too. And remember, this is just the starting point. There are so many great resources out there if you want to learn more, websites, organizations, all kinds of stuff.
So keep learning, keep exploring, and keep advocating for your health.
And take care.
That's all for the deep dive. Thanks for joining us. We'll see you next time.